Hello and welcome to National Focus. I'm Kimani. Coming up, the Ministry of Agriculture gives attention to the beekeeping industry. Government focuses on increasing access to justice, and we bring you a special report on health spending for the past financial year. Stay with us for details of these and other interesting stories after this.
Think water, think life. Water refreshes, restores, cleans, and enhances growth. Potable water is a benchmark for development. DOWASCO is serious about its mandate to ensure easy access to potable water island-wide and provide sewage services for a cleaner environment. DOWASCO is your water and sewage company.
Thanks for staying with us. The Labour Party government continues to place emphasis on the nation's health. In the 2014-2015 financial year, healthcare has improved dramatically for the benefit of locals. Jana Hector has this report.
Outlined in the Growth and Social Protection Strategy is government's belief that poverty reduction can only be achieved through the growth and improvement of all contributing sectors. According to that plan, the development of health conditions that will enable current and future households to achieve and maintain a sustainable and fulfilling life is critical. Hence, the numerous strategic and very costly endeavors undertaken in the healthcare sector throughout the past 15 years and more recently in the past 2014-2015 financial year. Government's economic and social review for that period highlights those achievements. The island's primary healthcare system is its pride and joy. In the past financial year, reports are that the system's health education programs have been sustained in all health districts. Additionally, patients are able to be screened and examined at health centers. They can also access clinical services, surgical and eye care, antenatal and audiology services at negligible rates. The dental services offered at the primary level are not, however, negligible. For the year under review, more than 11,000 were seen and treated at the dental unit. A dental health services manual was launched in 2014 to guide dental practitioners. Plans for the island's health centers in the near future include roof repair and storm drain construction for the Roseau Health Center, and the renovation and fencing of the Bagatelle, Newtown and Dodan health centers. Government will also install water tanks for all health centers in the Roseau district to serve as a backup water supply. A new Coliho Health Center is planned on the site of the existing one, while a new location for the Vickers Health Center has been identified. Plans for the Margot Hospital are progressing. The steering committee has been established and has met. The project is estimated at $1 million. A steering committee for the Portsmouth Reginald Fitzroy Armour Hospital is also in place. Discussions with Ross University are ongoing. The pillar of any good healthcare system is competent human resource. Through government efforts, training opportunities are constantly being secured for local experts. Several newly specialized doctors have returned to work in the fields of psychiatry, internal medicine, orthopedic surgery, pathology, infectious epidemiology, radiography, and cytotechnology. 15 new nurses have joined the service, and 13 were under review at the end of the reporting period. 29 other Ministry of Health officials have also been trained in quality management. The Social and Economic Review reports a reduction in infant mortality. This is due in part to a program funded by the European Development Fund for just that purpose. That program has also seen to the enhancement of the maternal and neonatal units of the Princess Margaret Hospital. Government has joined forces with several countries for the advancement of the local health sector. The Cuban government facilitated the services of a facio-maxillary surgeon. The People's Republic of China donated equipment valued at $400,000, which include nebulizers, digital portable ultrasound scanners, fetal monitors, and a mobile X-ray machine. The Chinese ophthalmology surgical mission performed 88 cataract surgeries free of charge and also donated important eye equipment in that period. The government's partnership with the United States yielded free surgical procedures for 7 Dominican children costing over US $800,000 and 41 other surgeries performed in St. Vincent. 4 more children are expected to receive surgery in 2015. 120 health professionals have been trained in a trauma management workshop facilitated by 2 US-based Dominican specialists. A US-based company, Topcon, also donated an optical coherence tomography machine to Dominica. In HIV/AIDS care, by the end of 2014, over 80 patients were being cared for at no cost to them at the Infectious Disease Clinic for HIV/AIDS treatment. Government foots the bill for their treatment. The 2014-2015 Social and Economic Review also reports that a National Infection Prevention and Control Committee has replaced the dated PMH Infection Control Committee. Meanwhile, an infection control and prevention performance assessment tool was tested at the Princess Margaret Hospital. Results indicate a high level of compliance with infection control guidelines among staff. That tool will be rolled out in the health districts. In that period, the National Infection Prevention and Control Manual was developed and launched. 40 derelict vehicles and over 61,000 tons of white goods and electronic waste was safely trashed by the Solid Waste Management Corporation. Meanwhile, a document outlining the national guidelines for the collection, storage, and disposal of solid waste is currently in draft form. The Environmental Health Department has been busy this past financial year. The unit conducted 38 food handler trainings across the island, making sure to reach each district. All of this has been accomplished while fighting on many levels the chikungunya virus, which severely incapacitated the workforce last year. Work on the new Princess Margaret Hospital will begin in this financial year. The project will be funded with help from the government of the People's Republic of China. That support is to the tune of $40 million US. The Ministry of Health is meanwhile doing its best to guarantee that the current structures are functional and secure and that a high quality of health care is maintained. During the 2014-2015 fiscal year, the Health Ministry began executing several small-scale projects, including the repair of the PMH medical lab floor, the renovation and creation of an isolation unit, and the repair of the roof of the Central Medical Stores building, all of which is costing government $500,000. In the meantime, government has been working to adequately equip the hospital to meet the needs of the population. So far, a surgical tower laparoscope for detailed and clear endoscopy has been procured at a cost of $1 million and a laboratory hematology analyzer for critical blood tests at $80,000. Diagnostic equipment has also been purchased: a CT scan, a digital mammogram, and a gastroscopy system. For the period, almost 2,000 people have required and accessed those services. The Labour Party government has maintained that a new hospital with new equipment and competent staff does not lack quality management and service. This is why medical professionals are being trained and the bills for their specialization footed by government. A patient safety committee has been mandated to monitor staff for conformance to procedure and safety guidelines. For GIS News, I'm Jana Hector.
Thank you, Jana, for that report. Dominicans can look forward to increased access to justice following the 2015-2016 National Budget Address. Honorable Minister for Justice, Immigration and National Security, Rayburn Blackmore, says the move will improve the economic well-being of all Dominicans through the delivery of quicker decisions, reducing the cost of litigation. Part of the process is government's move to intensify law revision and law reform.
The last law revision was done in 1990. Since then, many laws have been added to our law books, both in terms of current laws and amendments. As a consequence, a significant volume of our laws are not readily available, not only to the average citizen, but lawyers alike. To that end, therefore, your government has set up a law commission office to work on a general law revision exercise. This will provide a tidy, accessible regime of laws to all those involved in the administration of justice, as well as the average citizen.
This will also lead to the enactment of a legal professions bill.
Efforts will be made to modernize the laws, and we will enact a legal professions bill. This bill, when enacted into law, will provide greater protection and recourse for clients and lawyers alike.
$52.2 million was allocated to the Ministry of Justice, Immigration and National Security as part of the 2015-2016 national budget. The seismic network in Dominica will receive an upgrade. The Honorable Minister for Justice, Immigration and National Security, Rayburn Blackmore, says government is taking proactive measures to manage the country's disaster risk.
Under the World Bank Disaster Vulnerability Reduction Project, funds have been allocated to further upgrade the seismic network on this island. The Disaster Management Office has been mandated to draw up the terms of reference for a consultant in that regard.
Close to $40 million has been allocated under the Disaster Vulnerability Reduction Project, the DVRP. The DVRP seeks to measurably reduce Dominica's vulnerability to natural hazards and the impact of climate change. You're watching National Focus. Still to come, St. Joseph MP says major plans in agriculture on the cards for his constituency. Stay with us.
Children, remember, adults should not ask you to keep secrets that make you feel uncomfortable.
For more information on child abuse or to report suspected cases on child abuse, contact the Social Welfare Division on 33 Great Marlborough Street or call 266-3020 or 266-3080.
Welcome back. The Ministry of Agriculture has extended its support to the beekeepers industry in Dominica as a viable option in the agriculture industry. 25 hives were set up in a secure area at the Central Livestock Farm located in Londonderry. In a discussion at GIS Studios on Wednesday, Chief Veterinarian Dr. Reginald Thomas revealed that the aim of the Ministry of Agriculture is primarily to protect the beekeeping industry.
As part of the collaboration of the Ministry of Agriculture and assisting in the expansion of the industry, we recognized that we needed a national breeding area, if you may, or brooding area, as in terms of bee language, for new entrants or people just restocking. From a vet perspective, we looked at it, or disaster management, if you may, point of view. We saw it as if a disease were to hit our industry in the most populated areas, we wanted an area where we could have set up a biosecure facility that we could restock the island without trying to import bees. So we got on board with the bee cooperatives, or the project, as you may, and our contribution was to be there, provide the land, which we have at the Central Livestock Farm, and to put another animal species there, which is bees. So we basically have, we are basically setting up a biosecure area. We have set up protocols that in terms of people entering and leaving. We do not want anybody to get into there. This has to be logged, because we want to ensure that this stock of bees is as clean as possible, and they can become the national point at which we restock or expand the industry, or expand the industry.
Dr. Thomas says there is a local demand for honey and other bee products. He is hoping that attention to the industry will heighten the interest of nationals in beekeeping and encourage beekeepers to produce more than enough for local consumption.
There's no reason why we should be importing any honey. We have a perfect environment for the rearing of bees. We have, in terms of the nature of our flora and fauna, it's almost, you can even start to talk about organic honey. So that is the nature of our industry. We're looking at and working with the industry, providing the conditions for the expansion of the industry. Again, the ministry is looking at it as collaborating and not being the major player in it. We're trying to provide the enabling environment, if you may, so that industry can flourish.
There is also an external market, he says. The Ministry of Agriculture is also looking to expand the reach of producers to take advantage of those markets.
We have identified that Dominica's honey, because of our diversified flora and fauna, can enter most of the markets, and we are very interested in looking particularly at the European market via Guadeloupe and Martinique. We also facilitated in many ways interaction between some of the beekeepers, and we had a visit, I think it was 3 or 4 years ago, of Matnican Group that helped us again in strategizing how we went forward.
A Jeff Small Grants program has funded a beekeepers project on the island, which includes training, increasing production, and unification of all beekeeping societies on the island. GIS will bring you more on this project in subsequent newscasts. The Honourable Member of Parliament for the St. Joseph constituency, Kelva Daru, says agriculture in his constituency will see continued development in the new financial year. Addressing the House of Parliament last month, the Honourable Member of Parliament highlighted several ongoing projects that he is confident will provide windows of opportunity for numerous individuals in his constituency. Among these is the commissioning of the much-anticipated $10 million national abattoir financed by the government of Venezuela, the operationalization of the coffee processing plant, and cocoa rehabilitation efforts. Honorable Daru also reminded the House of Parliament of steps taken by the DLP government for the rehabilitation of feeder roads in his constituency.
We've not turned our eyes to the farmers on the farm access roads. That is why the contracts have been signed for the Salisbury Heights Car Feeder Road, and 2 contracts have been signed, Madam Speaker, and I believe this is a very important move on behalf of the government. And I recall when the Prime Minister visited there, along with the Minister of Agriculture and myself, we were touched. And that is why, Madam Speaker, the Prime Minister kept his word to ensure that we provide the farmers with better road conditions, and we'll continue to see more farm roads being addressed under the banner accompanying measures. And of course, the farmers in the Atley and Niba area, this is one of the roads that will be featured under the BAM for this new year.
The St. Joseph MP indicated that the Layo Valley area will continue to receive attention to assist farmers and residents.
We've already contracted the loan from the Caribbean Development Bank, and in this year's estimates, $3.5 million has been set aside to see the actual start of works works there in the area, to ensure that we can bring back the place to normalcy, and we can see this entire road network from the Heathrow Bridge all the way up to Port Cassay being totally rehabilitated.
This will also include the erection of a river wall. A bridge complements the People's Republic of China and the Hurricane Community Shelter. He added that farmers will also benefit from a second supply of 20,000 banana plantlets to come in this year from France. In the 2015-2016 National Budget Address, the nation's finance minister, Prime Minister Roosevelt Skerrit, outlined the plan for economic development in this new financial year, which centers on agriculture. Over $4 million of the 2015-2016 national budget has been allocated to provide assistance to existing and potential farmers. A total of $11.3 million was allocated for the development of both the agriculture and fisheries sector. Meantime, the Honourable Member of Parliament for the St. Joseph constituency indicated that Cabinet has also approved 2 drainage projects for his constituency under the Climate Change Resilience Project funds. He says the St. Joseph bypass is also a very important project.
Very importantly, a project that is also very dear to my heart is the St. Joseph bypass. And yes, the St. Joseph bypass. This is a very important artery which connects St. Joseph to Layo, and this project will be done in phases. And I have already spoken to the Minister of Finance, and we're looking at ways that we can begin the actual works in this financial year on a phased approach, so we can see an improved road network as well as the protection of the property in that area.
Plans are also in place for the development of the Spani Falls area in Bells in collaboration with the Tourism Ministry.
The Spani Falls has now become a very popular tourism location, and it is one of the most visited falls on the island. Some works have already begun in that area, and we anticipate in this financial year to have some works completed that will make it more accessible to the visitors and the residents alike, provide the opportunity for washroom facilities there as well, and make the walkway to the falls more suited so persons can walk properly going to the falls, and also have an area for persons to socialize, recreate, and have their meals and so forth. So we're looking at this project in this financial year, and of course it is all encompassing the whole community tourism drive that this government has undertaken.
And that's the English segment of the news. McPherson St. Luce is up next with Creole highlights.
Alors tout le monde, bienvenue à cette nouvelle en créole. Non moi c'est McPherson St. Luce. Premièrement, officier département quarantine Dominique, qui travaille et puis officier Brésil, qui était ici qui assisté au gourmet virus Red Palm Mite, qui a bien détruit Dawe Kokopéa. Parole celle-là, sorti votre chef département celle-là, M. Ryan Ansem.
Nous pas travailler seulement face to face, qu'on dit. Nous avons toujours email, nous avons toujours fait contact avec internet là, nous avons fait confiance avec eux, et ils ont aidé nous, nous bien contents. Et pas seulement nous avons reçu un programme audio et ils savent comment ils ça aider nous à d'autres bagailles. So ils savent comment le programme nous a fait Dominique et avec ça pour notre programme ça nous a fait Dominique. Parce que comme ça Brésil, Sud Brésil même n'a pas la pluie, il y a même climat pas Brésil que Dominique. So collaboration ça là bien bon pour nous garder comment nous avons gagné code ça.
On a nouvelle officier ministre santé qui a expecté pour assister le département pour empêcher l'abaissement de drogue et puis plan 5 l'année il a implémenté combattre l'abaissement de drogue en Dominique. Parole celle-là sorti officier département celle-là, M. Malcolm St. Rose.
Nous avons regardé aussi ça nous avons health services response. Ça c'est là tout ce monde là même qui travaille dans le département health. Puis si on sont nurse ou sont docteur ou sont n'importe ça en health. Nous avons juste extendre ça pour d'autres places en société. Comment nous avons répondu? C'est nous avons fait va-et-vient. C'est est-ce que nous avons fait ça nous voulons, d'autres monde fait ça nous voulons? Est-ce que nous avons gaspillé temps parce que même information là nous d'autres monde collecté est-ce que nous avons servi ça en interest pays là avec bitin comme ça? Nous avons regardé côté human resources. Est-ce que nous avons assez de monde qui travaille ces différents côtés là? ça compte qualification, training, never bien comme ça, c'est ça important. Qui ces challenges là, il y a expériencer. Et dans l'autre area nous regarder compte en plan ça là, c'est l'argent, c'est finance, budget, nous savons l'argent où est pour venir, mais comment nous savons des corps, comment nous savons faire bien de manière nouvelle, innover, faire manière créative pour où des corps absence l'argent là pas là.
La nouvelle ministre de Santé, Honorable Dr. Kenneth Darrow, a confirmé que la construction de l'hôpital neuf pour Dominique qui a commencé l'année financière. Honorable Darrow fait parole pendant qu'il par délégation gouvernement qui a adressé un grand meeting en mars la semaine passée. Selon le ministre Darrow, il y a encore 52,1 millions de dollars allocation budget qui allait pour financer le projet. Le gouvernement People's Republic of China a aussi joué un pas autant significant financier projet là. Le ministre Darrow aussi mentionné traitement pour officiers qui travaillent en facilité là, aussi pour maintenir l'équipement. Travail design qui aussi commencé pour l'hôpital neuf Marigot l'année financière là, aussi réhabilitation à l'hôpital en ville Guantans. Et puis finalement, le ministre de la Santé a adopté un policier ACCNC10, ça c'est maladie comme Pissadou et maladie comme ça. Parole ça là, sorti au permanent secrétaire, ministre de la Santé Helen Roy. Roy fait parole qui ont sauvé déjà conduit et puis un policier national adopté.
Bagay kono ni yona 3 moun qui ni high blood pressure, yona 5 moun qui ni diabetes et puis parler tout contre moun qui ni high cholesterol et puis yon moun media la made ça est-ce qu'il nous connaît c'est ça et puis ça nous qu'a fait. So moi répondre et puis moi dit qui ça c'est bagay qui nous voyez ça c'est serve nous fait Dominique so c'est statistiques nous c'est pas bagay nous pas connaître compte et puis puisque nous taper statistiques ça la serve là ça nous déjà fait, c'est nous développer un national policy en les CNCD, le gouvernement déjà accepté ça, et puis c'est ça nous qui travaillons, et puis nous aussi, ça nous voit qui fait ce gouvernement, through recommendation, nous fait le gouvernement, il y a civil servants, ni yon hésitant tous les 3 jours semaine yo ça les fait exercise nous ka travailler puis private sector public sector pour exercise nous aerobics classes nous ka train mon food care so nous yon paquet initiative nous ka fait et puis ça c'est pisky of results ça là ça.
Messieurs mesdames, ça c'est tout pour nouvelles en créole pour à présent. Non moins c'est McPherson. Au revoir.
Coming up, your tip of the day.
Child abuse is unacceptable. Child abuse is not cultural, it is criminal. And one child abuse is one too many.
For more information on child abuse or to report suspected cases on child abuse, contact the Social Welfare Division on 33 Great Marlborough Street or call 266-3020 or 266-3080.
Every food we eat provides the body with a range of nutrients which helps us to stay healthy. And if eaten in the right proportion according to one's body weight, age and gender, it can also aid in weight loss. However, it is important to eat the right food at the right time. Eat breakfast like a king, lunch like a prince, and dinner like a pauper. Why? Fueling up makes sense earlier in the day when your body needs the most calories for energy. And that's all for this edition of National Focus. We always welcome your suggestions and comments. Drop us an email at gis@dominica.gov.dm or visit our website news.gov.dm. Like our Facebook page, facebook.com/GIS News Dominica, and follow us on Twitter at GIS Dominica. You can also catch up on past National Focus newscasts on our GIS Dominica YouTube channel. From all of us here on the GIS News Desk, I'm Kimani. Thank you so much for watching and join us again next time on National Focus.